Back. AI is changing how healthcare professionals provide care and how patients receive it. Today, we shall find out how we can learn more about what AI in healthcare means today and in the coming years. And of course, we won't be doing this alone. We've got a guest,
In
but
the
Queensley will do
studio.
justice to.
Okay, so our conversation for tonight is on our last conversation is going to be on AI in the healthcare sector. And our guest in the studio is Engineer Nzube Ndiokwelu, and it's going to do justice as always to this particular subject matter. Good evening, Engineer
Welcome.
Nzube, and
Good
welcome.
evening.
Okay, so like I always say, I don't want to go over the explanation of what AI is, but because of what we just have here, can health AI really replace humans in the healthcare sector, or it could just be used as a helping hand there?
Yeah, I think AI is going to actually augment what humans are doing, and you're going to have more precision to what we do. And yeah, that's what we are going to see with integrating intelligent systems into these healthcare models that we have. And then we can actually move into new paradigms when we now integrate, the ability to actually, augment the doctors with intelligent workers around them. And yeah, I think we're going to a new era.
Okay, just before we go into so much details, how can the AI actually help in the healthcare system?
Okay, so currently, right now, I think we can almost but admit that even the doctors themselves admit it that AI is currently already analyzing thousands and millions of data sets in terms of like radiologists and X-ray data. I mean, think about it. One of the funniest things that you have to actually do is be a radiologist and have to look at an X-ray and have to say, I think there's a tumor somewhere there. You're making guesses. So right now, a lot of those scans, the doctors now feed them into these models, and the models now, are able to actually make precision, guesses to them, and then they can now rely on their own training to now say, okay, yes, this must be this, or this should be this, based on the patient in front of me. So we can already admit that right now, where we are now, AI is already augmenting what the doctors are already doing by analyzing a lot of the results which they get from labs and different tests that they already perform.
Okay, but is it usually 100% accurate? Because before now, you had mentioned that it is not always 100%. It depends on what you feed it, and it just gives you back. Would you say that the result that is being assessed by the AI, or rather brought out by the AI, is it usually 100%?
Well, this is where you have that human in the loop system, which, just like I said before, if you take a look at the AI models right now, you see that whatever that the doctors give it to it, when it gives it back, they also have to be the ones to say, okay, this is most likely this. Because they actually also have to assess the patient in front of them and rely on their own training. So the AI is able to, ensure that their blind sites are actually minimized. So let's assume that perhaps you are having a difficult day, or you had a burnout, or you missed a particular data which could have actually, correlated to something else. And so the AI could actually, give you a narrowed precision of this could be this or this could be that. And then you can now, with that information, probe the patient further.
I mean, we are dealing with human lives, which is really delicate. And if anything goes wrong, who is going to take the blame?
I think this is something that the government now has to come in and say, yes, let's know how we regulate these things, because we're going to reach a period where, if we're going to imagine, okay, as always, let's imagine the future. Imagine where most likely you're going to have digital twins. And then these digital twins are going to be like, biological, let's say holograms of you, which the doctors could actually, before actually even conducting a test on you, could actually simulate what the outcome of this test could actually be on this patient using the digital twin, not even in surgeries. So you can actually predict how you're going to actually react to a drug based on your biomarkers and your genetic lifestyle. So we're moving to an era where you're going to have hyper personalized, tailored medicine.
Okay, Okay,
So
go
with
ahead.
with
Go
the
ahead,
inversion
Lily.
of AI in the medical sector right now, I don't know, for Nigerians, do you think Nigerians are ready to receive AI in getting medical help?
There's no time to be ready.
Okay.
We just can't be ready for something like we don't wait for it.
Are we even
Do you get-
sensitized? Are we even sensitized enough?
that,
Because
that- that's
people will be scared.
that's the point I'm trying to say. We have to prepare.
Okay.
We don't just say, "Are we ready?" We've never been ready. We must start preparing. The future is about coming. Are we preparing right now? What are the guidelines we are doing? Are we remodeling our systems? We can reimagine our healthcare. Currently, we basically don't even track the important metrics. How many healthcare systems do we have that we can say these are their survival rates? That this is the mortality rates of these different hospitals, and based on that, you take informed decisions and take your loved ones to those hospitals. We do not have this. We do not ask the right questions. And so, right now, in the previous systems we already designed, we're already outdated, and we're moving into a new era. We can't still expect to move with the old era. We don't even need bulky hospitals anymore. We can reimagine what we actually, we move into preventive medicine. My dad was a professor of preventive dentistry before he died. So ahead of time, I had this understanding that medicine shouldn't even always be reactionary. It should be preventive. So we should have, design our healthcare systems to actually, move along with these paradigms. We should have standard diagnostic centers which are standardized, which, we leverage AI, leverage these intelligent systems that are already available. People can actually walk in with a low cost, and then you rapidly achieve a lot of diagnostics. And even with that, you can then just have the AI, recommend this person based on this information, just basic preliminary scan. We are referring him to this hospital, referring to this hospital. For me, I believe the first thing we must do is to start asking the right questions. Start realizing that we must design the systems. They don't exist by themselves. They're not going to come to us from nowhere. Somebody must say, what we have doesn't work. How do we, from top down, redesign every single thing, both from the curriculum to the industry stakeholders to the infrastructure to power to internet? We must always, take a look at this and say, okay, as we're moving into this new age, do we have, specialized centers which are like, we concentrate capital in a particular area to ensure that even if it's one tier one, and we rank the type of diagnostic stuffs we have.
So let's look at sensitizing the citizens, those that are not aware. Because even if today we hear that there's an AI hospital somewhere around the corner, many people will not go there because the mentality is that it's for the wealthy, it's for the rich. It's not where I can go to. Because a normal average hospital is expensive to deal with, let alone an AI facility hospital. It will be very hard for you to go. Do you think the government is doing enough sensitizing people in respect to technologies like this?
Technology and, as technology advances, the one thing it does is it reduces the costs.
In this part of the country, does it really do that?
It will. If
But
not-
yet it doesn't.
if properly implemented. You see, one thing we also do is we do not actually work with our A-game people. We know our elite people in this country. We know the people that can actually get the job done. We actually, don't always implement properly. We may get elite people to, formulate policies, but we don't get the job done. What I'm going to say is this. We can actually take a look at this and say, for this purpose, we're going to create just this center. I believe it's not really, we have type 2 health centers already built up in Enugu State. And then we can start with, model places. Focus on diagnostics, leveraging AI systems. There are urinals that exist right now that all you just simply need to do is walk in, take a piss, and then it actually, gives you a report based on your health data. And this is actually going to be way more cheaper than actually accessing those tests. on demand, and you are actually also relying on, human, efficiency to actually, have reliability on that, information or the test which you conducted. And then when you have something that really tells the entire public that there's this here, and this is how reliable our systems are, we have to start working with the right words. We have to start moving with merit in every single thing we do. It's not a question about saying it's for the elite. The elite are even looking for high efficiency. They don't even know what high efficiency feels like. So until we start creating model centers where, word of mouth is the greatest way of spreading information. The minute you walk in there and you say, this thing, actually, just imagine
Everybody rushes to that same
a
point.
trader's reaction.
Well, let's look at the ethical aspect of it. Is it really ethical to allow machines have access to sensitive health information, knowing that in a world like this, we're already prone to the abuse of data?
When it comes to ethics, at the same time, these are things that is left for the regulators to sort out. There are always, what's it called, regional sensitization summits and workshops, which are being done and conducted by different government agencies with respect to formulating policies which would regulate this data and fair use. I always advocate for us to really responsibly, ensure that we proactively take a look about how this health data are going to be transmitted, and devices that are going to have the ability to transmit health data, and what their reach is with respect to, do they send offline data to servers outside our shores? Do we localize our data within our shores? These are some of the things which I believe these workshops should ensure that you have your A-list people telling you what to do and how to go about these things.
Okay.
And then looking at trainings, we have challenges, cases where many people complain that there are doctors that don't really know their job. They don't really know what they are doing. There are cases whereby you see, I know someone too that it's not like crippled because of the nurse injected it wrongly or something.
Okay.
Different reactions like that. Let's talk about trainings for AI. Do we have the manpower to adequately train Nigerian doctors, to do it right, if we should have something like that in Nigeria?
This is very, very interesting, because beyond just saying that you're going to have a future where robots are going to, help with precision surgeries, you're also going to take a look at the human in the loop factor. Do you have the ability to interpret and work hand in hand with these new machines? But I believe, like I said, these are things that you roll up in a way that you ensure that there's a need to redesign the entire system. When I say, it's not something that you just go and create the model center and that's it. No, when you do that, you redesign your curriculum to ensure that you train out a future generation of people or health workers which are actually already proficient on this. And then with that particular model center, you could create another shadow model center dedicated to training. You have hospitals, you have teaching hospitals. Those teaching hospitals are dedicated to ensuring that those doctors, nurses, and health professionals get the required training before they then have, one-on-one encounter with patients. So this is the same thing that you have to still imagine that approach. And we must make sure we get it right. The minute we take one and forget the rest, you see that you've already lost the plot. So you must have a unified approach. It's something that you bring every single person into the room, you bring the key stakeholders into the room, and everybody understands the job at hand. It's a pilot, like this is a Marshall Plan. I keep saying it, it has to be a Marshall Plan from the top. From beginning, we understand what the job is, from administration to administration, irrespective of the politics of the day. What we are focused on is our advancement, it's our ability to ensure that we design new systems that are going to be enduring and actually ensure we save lives.
So
Because this is the most important thing.
So another aspect of it, when people hear of AI, they always feel like their job is at risk. They're being threatened by their job. So how can this also be integrated into the healthcare system in a way that it helps with the workforce and relieve doctors of certain things without also having to be a threat to their jobs?
Currently, I do not know the stats offhand, but the the ratio of the patient to doctor ratio in Nigeria is quite alarming. So when we talk about losing jobs, I believe if you ask the doctor, they will tell you that they really need their workload to be reduced. They're burning out from actually, having to attend to a whole lot of patients at the same time. And at the same time, with the amount of money they're being paid, their remuneration is not commensurate with what their workload is. So if the AI is going to do anything, it's actually going to reduce their workload. It's going to ensure that the doctors don't burn out quickly. They're going to be able to focus more on the patients. You can have intelligence systems that are in the room, listening and transcribing notes from the doctor, already even making prescriptions for the patient before the end of the consultation, while the doctor simply just pays attention to the patient, which is the most important thing. Because when you see people complain about doctors, they're humans. There's a limit to what you can expect.
Yeah.
And more often than not, I lost a friend very much recently to inefficiency in their healthcare system, just in Enugu State, less than 2 weeks ago. And this is something I'm really, really so passionate about right now, that we must get it right. Until you go through that experience, you realize that we must get it right. And it's not a question of apportioning blames. We must get our A game, people, into the field.
Sorry about your friend, but the question now is that should Nigeria, the government, invest into AI? Looking at how hospitals, even getting simple things that you feel wouldn't have taken long in Nigeria would take years, maybe a particular tenure before that project will be done. And they'll start to mention the amount of money they're investing in it. With the likes of AI right now, is there a suggestion from you that Nigeria should invest in AI, or they should go back to the drawing board and fix the hospitals, the infrastructure, the equipment, the machines, put things together, get the right amount for salaries for doctors, and make sure that the health sector is in shape?
The private sector either leads with capital by making smart capital allocations to ensure that we have these frameworks in place, and then perhaps the public sector, which is the government, then catches up. Or the government can responsibly, lead from the front. It's not really a question of should the government. We don't have a choice.
Corruption is the choice. No. The angle I'm coming from is projects like this. You hear, oh, we want to go into AI, healthcare, and it will take years. They'll tell you 100 billion is in this. We want to change Nigeria in a few months. Meanwhile, some Nigerians may really want that 100 billion to be pushed into the rural healthcare sectors, different angles that we can see the effect of this investment.
I think we're going to see a future where if the government neglects their role, we're going to see more private capital, take over the responsibility of the government. And at some point, if the political class of the day isn't aware that there's a responsibility and the civic handshake between, the ruling elite and the masses, and there are essential amenities and services which you provide in exchange for their taxes and all that. When it's now outsourced to private capital to provide these amenities of the day, you'll probably see a shift in the societal dynamics when that happens.
All right, then. So let's look at outbreak of certain diseases that happens very often. Can AI really be used to, tell this outbreak will come out, and the outbreak that we're expecting. I mean, in times like this where we have the rainy season, we are prone to things like this. And sometimes we've experienced it in the past whereby we have an outbreak, it takes out hundreds of people before you even realize what it is, and by then you have hundreds of people already dead. How can AI be utilized in this aspect to actually tell this outbreak before it gets to the larger number of people?
Well, like I said, it's now a period where with these intelligence systems, you can either embrace preventive measures or you are always reacting.
Is that where you talked about the preventive medicine?
Yes. So AI actually helps you to move from a reactive stance to a proactive stance. So when you actually have a track record where you see that you are actually always reactive, never proactive, you're never ahead of the curve, and then you then have a system which is going to help you stay ahead of the curve. If you do not stay ahead of the curve, I'm going to ask myself, why should I actually pay attention? Why should I pay taxes? Why should I actually, because you should provide these amenities, and we all have a collective duty of knowing what we should actually want. More often than not, the challenge is we do not even know what we should aspire to. You often see governments spend a lot of money trying to achieve something. The challenge is that same amount of money could actually provide something much more efficient. But you may not actually have these people aware of the state of the art or where the technology is at or the progress in the field. So without these advancements of people within that system, you may not actually always see it. So like I said, if the private sector moves ahead and then now provides these amenities, you could actually now have the government of the day say, okay, so if this can actually really be here, I can actually really now say, I can promise my people this. Without seeing that example, they may not even be able to imagine it. And they may still be imagining ultra-modern classrooms, ultra-modern hospital blocks, ultra-modern everything, without it being in any way modern.
The number of students going to school every now and then and graduating, they're in the thousands, particularly medical students. With the emergence of AI, is it going to be a threat to these students that are hoping to get jobs as doctors in Nigerian hospitals?
First of all, they should upskill. They should catch up.
They should turn to AIs?
Yes.
Because I was about to ask what do you mean by catch up?
The first thing I always tell everybody is find out where the state of knowledge in your field actually is right now. If you're in Nigeria, the first thing you should do, use AI and find out where your field actually is. If you're in physics, where is it?
Is it in other parts of the world?
No, yes, because this is a unified knowledge field. If there are advances in Nigeria, those advances actually reflect everywhere. If there are advances in UK, they should reflect everywhere. But more often than not, there's a disconnect. We've not actually caught up. So we're still being taught things of yesterday. So we need them to, first of all, use this, this period of geopolitical challenges where people are going to be traveling out, people want to japa, countries are shifting their immigration stance. Use it to upskill. Figure out where the current state of knowledge in your domain is. Then from there, decide. There's a lot you can figure out by simply being up to date.
Can we look at the challenges? I wish I wouldn't say this, but this is Nigeria where anything could happen. Even if we have AI right now, do you see the common man having access to it? Because whether we like it or not, it will be expensive. Be it the private sector or the public sector. AI, medical facilities, hospitals will be expensive. And that's where corruption will breed in. It's only the rich that will have access.
I'm here to correct you again.
Tell me.
That is a fallacy.
Okay.
AI is in no way expensive. You currently even have AIs in your pockets. Every single person now that has a smart device.
Having access to that particular medical attention
at
with the
Meta,
aid of
every people in your WhatsApp, just simply say at Meta. People are doing it. Go on Twitter at Grok.
The image that comes to
The
mind.
point being, you already have access to these intelligent devices,
Yeah.
but you actually don't see it. You see, the rate of progress is so fast that people don't really appreciate what's going on. Take a look at Twitter. People make a lot of unintelligent discussions.
Okay.
People actually don't even know what they contribute to, but they just simply wish to contribute to a topic. Now, what you now see more people doing more often than not is before they say something, they say, at Grok, is this true? They're trying to fact check themselves. And if you say something, you're going to see somebody come under your post and say, at Grok. So you're probably going to have the algorithm wonder or figure out those that don't get easily fact checked using Grok and those that actually always use Grok. And, you know, it's actually an intelligence amplifier if you actually understand what the AI models are doing. So when you talk about it being for the rich, to me, I feel like this is going to allow a narrative which the politicians could actually decide to latch on. I'm being sincere and saying it, that AI systems or AI embedded devices are actually not that expensive. You know, you could actually say that on a longer term scale use, if you're looking at the context window of these modern reasoning models, depending on what you are actually trying to use it to do. The efficiency gains we can get currently by being smart about how we integrate the current state of AI right now is going to be so massive. It's going to be so massive that you can literally feel it. So it's important we understand what we are missing out on. We have to keep harping on what we are missing out on rather than trying to tell people that it's expensive. Let us approach it, then let the people approaching it tell you it's expensive. It shouldn't be the politicians telling you it's expensive.
I think this is where the sensitization comes in.
Comes in.
Sensitizing people,
Yeah.
letting them know about this. Because when you mention AI, what will come to the common man's mind is maybe a robot, a machine that's working like
We've
this.
not gotten to
administering
hardware.
drugs and stuff.
Exactly. Now,
That's
speaking
nonsense.
of the poor masses,
Yeah.
wouldn't this cause an inequality in the healthcare system? I mean, if we have an introduction of AI in our healthcare sector, it will come to stay in the urban areas, therefore leaving the underdeveloped areas and rural areas out of this experience. And already we have a problem with the healthcare system in the rural areas already, whereby they are underdeveloped and they rarely have healthcare providers in these establishments. Let's not talk about how the structure of the place is. So won't this cause an inequality in both areas?
Let the masses breathe. Let the masses breathe. Even the late president, he didn't die in our shores. Even the elite actually still suffer.
Mind you that they have been managing that
So my
because of
point being,
because
the
of
masses
how wealthy.
actually don't have an option. They've never had an option. People that have never had an option, to the extent that even the elite abscond their best options that they exist in their shores. So that simply means that there's no option, there's no marginalization. They don't have an option. Give them an option. Before trying to categorize them as people that are actually marginalized, let us actually see what these systems are going to, let us observe, let us study. That's why I said, let us prepare.
Okay, I like your optimism.
Of course.
And we preparing.
Yes.
But let's look at some of the optics that we're experiencing in Nigeria. Let's talk about lack of electricity. There are some areas that don't know what power supply is. She mentioned rural areas. So some villages they use lantern and what have you. And these people are also humans that need access to these medical centers, AI facilitated centers. Do you see AI doing very well in Nigeria? With this poor electricity, corruption. We have to leave corruption there for reality's sake. And then we also look at insecurity.
Even basic medical internet access.
Yes, so internet access. So places like the north, some places that have insecurity issues, human beings live there. Can they also have something like that in those areas? Many people will not go there.
First things first, this is where I'm going to draw us back to something I said previously.
Yeah.
I always said that it has to be a holistic approach where we figure out a couple of different things around infrastructure, energy, internet connectivity, integration, what type of centers, what metrics we want to track, what the curriculum is, what the school models are going to be. The entire ecosystem has to be mapped out. Now, you highlighted an interesting part, which is what happens to the power, energy, and then how do you solve internet connectivity? You mentioned that too, right?
Yeah.
Okay, good. So, on the energy place, during the Startup Summit, which was organized by NITDA and the GTEx Startup Summit, which was done in Enugu State, there was a presentation from a founder. He presented something. It was done at the International Conference Center just some days ago. So he had this idea or this protocol which he had already built, which ran on the blockchain, which was a decentralized energy storage, where you could actually, have portable energy solutions, and then those that have those portable energy solutions could actually also outsource and sell those energy solutions. And a lot of these innovations are actually also creeping up on the blockchain space. And then if you take a look at Enugu, Enugu is about to host the first ever Southeast Ethereum conference in Enugu State.
Nice.
You get the first ever Ethereum conference in southeastern Nigeria is organized. It's been done in Enugu State. A lot of these innovations on the blockchain protocols are actually going to help merge some of the advancements and the concerns we have on the AI space. So if you're talking about energy, we already have people, even in the local scene, trying to sort out how to solve energy on that part. On the internet connectivity space, we have another local company, Zend, which has actually produced a device, Ycrypt. Sorry, Ycrypt. Zend is a sister company. So they have this Ycrypt, which actually helps users sell their internet connectivity. So you can have one Starlink station, and then you connect to the access point router, and you can actually sell your internet connectivity, monitor and regulate it, and even also earn from selling, earn crypto tokens by actually, So there's so many innovations going on in this space, which is why you must have everybody in the same room, so that those in the policy side know what is going on in the emerging technology side. You don't just focus on AI, you focus on emerging technologies. What is going on with the robotics? The robotics are going to bring in precision medicine, precision surgery, precision diagnosis.
Yeah.
You're going to have intelligence systems which are going to be, your guardian angels, digital twins which are going to, be modeled after your biomarkers. You're going to even have smart devices which are actually going to be listening into you and telling you ahead of your time, saying from your heart rate.
Can walk around with Siri.
Thank you very much. You see, it's already now happening. You're sitting down for a long time and it just simply prompts you and tells you you've been sitting for too long.
And you haven't drank water in a
Thank you
long
very much.
time.
So you see, you're already now being programmed by these intelligent systems, and it's already nudging you to live better, and take better choices.
Okay, so with the challenges that we've established that Nigeria is facing right now, looking at the emergence of the AI, how long, how many years duration can you give Nigeria to be effectively using AI medical hospitals? Let's be realistic from your own point of view as an optimistic person, and let us from our own point of view now see if it's the reality in ground
Or not.
or not.
5 years.
Okay. That's the most
Fair
we can
enough.
take on this conversation.
Fair enough.
We'll talk to you about this in 5 years'
If
time.
nobody builds it, I would have built it.
Amen.
That's why we'll talk to you. So thank you so much for joining us on this, or for tonight on this particular conversation. Our guest is Engineer Nzube Ndiokwelu, and our conversation is on AI in healthcare. Thank you so much once again.
Save Nature TV, news in your pocket.